Hey guys, Dr. Peoples here. So, if I haven't convinced you as of yet why this pandemic is super important, I want to show you a video that I came across that I think does a really excellent job of sort of breaking down what I think is going on right now, early in this disease pandemic process. And then after you watch the video, we'll come back and I will break it down.
On day one, no one you know is sick. It feels like a normal day. It may stay like this for a long time until one day a few people you know are sick. And suddenly, a few days later, it will seem like everyone is sick, and it will feel like it happened instantly. Everything looks fine until it isn't fine. This is the paradox of pandemics. And it's why, with an outbreak like COVID-19, you hear health officials calling for huge, drastic, and rapid responses in the early days when infection numbers are still relatively small. Some people worry that these actions are overreactions. Sports teams playing to empty stadiums or not playing at all, canceling huge gatherings and festivals, temporarily closing schools and offices, telling people to avoid personal contact. Media sensationalism. But this way of thinking fails to appreciate how disease outbreaks work. It was really never fine to begin with, but we don't notice until it's too late. Hey, smart people, Joe here. How bad will the coronavirus outbreak get? That's what we all want to know, and the answer is in one of these curves. This is what a rapid global pandemic looks like. Little to nothing to slow the number of new infections means a lot of people sick in a short amount of time. A slower global pandemic looks like this. The rate of new cases is lowered and they're spread out over a longer period of time. And which one of these paths that we end up on is important because of this line. It represents the capacity of our healthcare system, the number of beds, doctors, respirators, and everything else. What experts fear is a sudden explosion like this, overwhelming this capacity. And what's really interesting here is that even if these two curves represent the same total number of people that eventually get infected, in the rapid outbreak scenario, more people will die because there won't be enough hospital beds or ventilators to keep them alive.
Okay, so there are a couple of things I want to bring up about this video. So one of the things that I'm seeing in the community is a lot of people have some preconceived notions about this disease that are hampering our ability to get a handle on it. Number one is that people think that they don't know anybody who's sick, they don't know anybody who's died, that it's distant, it's them, it's not us. And so as a result of that, they think that everybody else who is a health professional and trained to look at pandemics, who are asking people to social distance and to stop working and to close down schools and to shut down restaurants, are overreacting, that we are all overreacting. And I'm not going to say that I didn't think, maybe in the very beginning, I might have thought, oh, this seems a little strange. Why are we being so aggressive? Is what's going on here? So I'm not going to act as if, in the very beginning, a week ago, I didn't have questions about how severe this was going to be and what were the ramifications, which is why I took a lot of effort to read up and figure out what exactly is going on and what are the people in the back rooms making these decisions thinking about when they tell us nobody can go to work, even at the expense of the economic markets and expense of people who work from wage to wage, employees who are really going to suffer as a result of not being able to go to work. I mean, these are drastic measures. So something drastic must be going on. And the answer is yes, there is something drastic going on. And the reason you don't feel it quite yet is because there are trained professionals who have studied and looked at models about how pandemics work, and they are able to identify a problem way before it happens. And so what you may be considering is overkill, I consider as being behind the eight ball. I truly believe at this point we are behind the eight ball in the sense of there are many people who are going to die of this disease that don't have to because we haven't taken aggressive enough action as of yet. And the real reason that is because of what they talked a little bit about in the video. When you have a spike of disease in any one situation or one area, it overloads our healthcare system. And so not only do we have a disease that is more lethal than the flu and more contagious than the flu, but we also have a situation where the people need to be hospitalized because of this disease at higher rates. And as a result of that, it's going to mess up and cause an imbalance in the way that hospitals work and what care and services we can provide. So let me just tell you my experience as a physician who works in a hospital, specifically with patients who are on ventilators. There are only a certain number of ventilators. And even at where I work, before COVID was an issue, if I needed to transfer someone out of my facility into an ICU facility, it was really hard to do because there were no beds, right? Because patients were in there with the flu and they were taking up beds. And so before COVID even started, we had an issue with capacity, right? And we would have to move patients around to make sure we could service everyone. Right now, we're in a situation where we can anticipate more people coming into the healthcare system, and we already know we don't have enough resources. We don't have enough ICU beds. We don't have enough ICU doctors. We don't have enough ventilators. We don't have enough protective materials, which means that healthcare workers, doctors, nurses, respiratory therapists are at higher risk of getting infection. And so this is a pretty scary situation. And if we know that this is coming, can we rev up to prepare for it? And my opinion, as of today, we're not revving up quick enough. I don't know that all the resources that need to be put forward to make sure that we have enough resources to handle what's coming, I don't know that we're doing enough yet. And so again, the reason I'm making these videos is to really plead to people that it's important that you follow the instructions as laid out by the CDC to stay home, to self-quarantine. I would go even as far as to say that everybody needs to be on a national quarantine. Now, in the next video, I'm going to talk about why a national quarantine may not even be the answer, and what are some of the questions and possible some of the things that people are thinking about as the best way to address this pandemic. I'm also going to link some videos that I think do a really good job of explaining this and have nice visuals and stuff like that. So let's jump into the next video.